Thank you. Thank you so much to Dr. Soki for that really kind invitation to the meeting today. Let me begin by perhaps just thanking the organizers of this conference for making it possible for all of us to meet. You guys physically, it would have been great for me to be there, but due to many issues, I can't be there with you in Mombasa. And let me also thank my teachers who've gone before me. I think I've sat through Prof's presentation, and Prof, you reminded me of things that we don't deal with anymore in this public health space. Podocytes and glomeruli, I had forgotten even how you spell them. So thank you so much for that reminder, Prof. I see Dr. Ngige there also, one of the team members who we work with greatly in the Ministry of Health. And so thank you all for this invitation. I'm greatly honored to address you today during this important conference that touches on the lives of our people. And the theme of the conference today, evolving care in nephrology, coping and adopting in uncertain times. Having listened on since around 5:30 when you began, I've been questioning myself some of the issues that are coming out, particularly from Prof's presentation. What role does policy play? When he speaks about testing for hemodialysis and the idea that we still don't have a policy position, on COVID testing for hemodialysis patients, then already there are certain light bulbs that are lighting up in my head in terms of what role the ministry can play in ensuring that we are truly part of the team and part of the journey in evolving care in nephrology. As you're all aware, kidney disease in Kenya has been projected to be the 5th leading cause of premature deaths globally by the year 2040. And it's also estimated that almost 5 million Kenyans are living with chronic kidney disease. Rather, we have estimates that tell us more than 12,000 people have end-stage kidney disease that requires dialysis, and currently we have about more than 5,000 patients on dialysis in Kenya. When we speak of the dialysis journey, I'm sure many of you, do remember the nexus of NHIF when it comes to dialysis within the country. And over the years, through different interventions and programs, including the MESS project, we've seen an increase in the number of dialysis units in the country. We're informed now we have close to about 214 dialysis units, both in our public and private sector, as well as our faith-based facilities. And, the teams in the ministry were remarking, for the number of dialysis units that we have, when we compare those with the number of human resources, when we look at our nurses, when we look at our nephrologists, there's clearly a need to invest in this HR space. And that's why I'm glad that we are here today in this conference, that I can sit in as a silent listener and observer in terms of how do we make investments in spaces, particularly HR, that match the infrastructural investments that we've done as government and as private sector and partners. I do take note that as highlighted, Kenya was actually on a good trajectory when it came to kidney transplants. From our statistics, we have about 661 kidney transplants that have been carried out in the country since 2006. And I do want to thank all the members present here. I see some of the inception brains of the Yaki Center in the room today. I see some of the people who are actualizing the KNH Kidney Center that we have. And so I want to thank each and every one of you for all the efforts that you've put in place to make it possible for us to get to 661. But more importantly, having now perhaps, scaled through this pandemic, you being able to ensure that this is a service that's still available, that continues to be available. Thank you for your efforts in that. We're aware, of course, of the significant role that kidney transplantation plays, particularly when it comes to end-stage kidney disease. And, one of the visions that we have, particularly which is part of the EAC presidential agenda, is to really see the Yaki Center up and running, but not just in terms of the infrastructure, the brick and mortar of the building, but also in the software of that building. Are we thinking about the financing of the services that will take place there? Are we thinking about quality assurance measures that should take place there so that it can indeed be a center of excellence when it comes to kidney disease in the country? Ladies and gentlemen, I think also one of the key things that we need to talk about and highlight, and particularly for our citizens, is the whole idea of bringing in place health promotive and preventative services. We all do know that amongst the common causes of chronic kidney disease include issues that touch on high blood pressure and diabetes. And basically, these that we call lifestyle factors that bring about chronic kidney disease. perhaps a challenge to us in future conferences, perhaps a challenge to us in future platforms such as this one today, is to actually have Mwananchi sitting there next to Prof, sitting next to you, Mwananchi, and sharing their understanding in terms of how can they partner with us when it comes to dealing with this lifestyle issue, then end up bringing CKDs and all of the internally as a ministry. We are looking to highlight the role that patient groups play. Had the good opportunity through Dr. Ngigi and Dr. Kamuri in KNH to actually interact with some kidney transplant patients. And part of what we're trying to do when we look at our quality of health policies is to actually put the patient in the center when it comes to policy design and put in place these patient groups that are actually a loud voice when it comes to some of the areas in which we resource. And in this case, one of the key things you're all aware is the issue of transplants and reimbursements by NHI for those services, and also particularly post-transplant services. Talking of NHIF, I think we have to appreciate them for the gains that have been made over the years. We all are aware, I think we remember the journey when NHIF used to deal with just rebates to today where we have different specialized packages available. Currently, and I think I saw this in the Business Daily yesterday, where they actually did an analysis of dialysis and payouts by NHIF. And the big question there by the author was on the sustainability of that and if the fund is really able to sustain that going forward. One of the discussions that we are having, and this is a very highly intense discussion in NHIF, how do we actually ensure the sustainability of this? How do we facilitate extra sessions of dialysis that would be required? But also more importantly, how do we that lateral shift, moving further away from perhaps dialysis, which we know would be needed, towards investing more in transplant services. A key thing also that would be of importance to all of you in this conference today is the issue that touches on the Kenya Organ Donation and Transplant Bill. I'm sure we all appreciate how that would be a major milestone when it comes to regulating the space, when it comes to ensuring that some of these transplants are ancillary services are availed, and also that the space ensures good outcome measures for those patients who go through transplant services. And so again, as we push this within the ministry, we are inviting this association to engage with us, to cooperate, to come into our different task forces to make this bill possible as we engage Parliament on it. The other issue I think that we need to look at perhaps is on the issue of accreditation. As we continue having more and more dialysis centers in the country, I think the Renal Association then plays a key role in self-regulation. And so how do we have partnerships with the Kenya Medical Practitioners and Dentists Council when it comes to assessing our units? I'm aware we already have ongoing site visits where the association is involved, but how do we standardize this practice? And how do we then also perhaps peg that accreditation to the reimbursement mechanisms by NHIF so as to provide incentives for the people who run those dialysis units to ensure we have good outcomes? And so really there's a lot of work in the different spaces that touch on kidney disease that we need to partner with you people as an association, and also, of course, people such as NHIF and the Ministry of Health in making that possible. We've had discussions with the CEO of NHIF as well as the board, and we've had proposals as to how we can, of course, consider third reimbursements, third session reimbursements, as well as how NHIF is able to propose kidney transplant services. However, one thing I'd call on the association to support, which is in line with this, is perhaps the NHIF bill. You're all aware government has put NHIF reimbursement packages. And so this is a bill that's in the third reading. It will be coming up as soon as Parliament is of recess, and it's something that we call on you to partner help your patients in terms of the services that they need. And so finally, allow me to thank them for the great work that you do, deliberations. So it now gives me great pleasure to declare the 2021 Kenya Renal Association Annual Scientific Conference officially open. Thank you.